Good morning, everyone. Thanks for showing up. Yeah, I'm going to take a different approach. I am in private practice, just like George, and there's going to be a lot of overlap, but I want you to think a little bit about your kind of definition of success. I have no disclosures, but I certainly have my biases. I've spent the last 17 years navigating my career and reevaluating it every few years, trying to find my personal success. So we have an audience poll. If you can pull your app, open your app, I'm gonna ask you a couple of questions, and I'd like you to answer on that. So the first question is, do your colleagues, peers, and mentors see you as professionally successful? If you can all go on there, and we only have one answer so far. How do I know how many people answered, by the way? Anyone having a hard time finding it on their app? Everyone found it? Okay, so there's a couple of questions, so we're gonna move to the next one. So 93% of us are viewed successful by our peers. So the next question is, do you yourself see yourself professionally successful? And this takes some thinking. Do you think you've achieved your metrics of success? This is very interesting. So this is split very different. So how we see ourselves and how others see us is very different. So the third one, I want you to now look at it differently. Do you see yourself as professionally happy? And that's a very different definition than success. So this isn't identical, but it's trending in a similar fashion as the last one. And those of you who said you were happy, that's 60% that said they are happy. I want you to think about this. Have you had to change your definition of success to achieve happiness? And look at that. So this is pretty much, I can stop talking now, because this is what I want to kind of instill upon you, that professional happiness, job satisfaction, and success are completely different metrics. So my hope is to empower you with the strength to assess and evaluate your career trajectory as you're going through it, and hopefully to push you to find the courage to actually assess whether or not your career trajectory and your happiness are in line together. Why is this important? I mean, there's a lot of sessions at this meeting now about burnout. I attended one yesterday and I was astounded to find that $4.6 billion annually is spent on physician burnout. 37% of that money is surgeon burnout. That is huge, and if we don't address it between that and the surgeon shortages that George alluded to, this is a big problem. Our surgical career trajectory oftentimes doesn't allow us for a surgical pause. We don't get a chance to stop and evaluate. I know a lot of people start straight from residency to their first job, quit their first job, go straight to their second job, don't even give themselves a month break. So this is how we're wired, this is how we're trained, and we need to take that time. We need to assess ourselves. We're growing just as long as along the path as our careers are growing. And this is partially at fault because of our training model. Our training models all cookie cut us into the same career trajectory with no allowance for self-expression. So what are your roles as a surgeon? How are we defined as surgeons? So yes, we're proceduralists, but we're also viewed along different pathways: educator, innovator, leader, researcher, administrator, patient advocate. But in all those different roles, how are we judged as to be successful? And this is where 99% of how you're judged externally falls into one of these categories. Do you have a lot of case volume? Do you make a lot of money? Are you advanced in your academic tenure? Do you have name recognition and fame? Are you asked to speak at every meeting? Are you innovator? Do you have a lot of patents under your name? How many publications? What's the impact of your publications? So there's a lot of metrics by which we're judged within our silo in surgery. And we're all on this path towards success, however we define it. But is that path to success leading you to job satisfaction and happiness? That is something that each individual needs to decide for themselves. So how do we rate our professional happiness and our job satisfaction? Now, if you ask a bunch of your colleagues, and I have, it's amazing that how we rate our satisfaction is not the same metrics, but by which we're deemed as successful. So no one said my job satisfaction is tied to my number of publications or my case volume or who recognizes me at a meeting. It typically tends to be a lot more kind of introspective. Am I autonomous in my role? Do I have camaraderie around me? Do I have job security? That's a big issue these days. Am I efficient? Am I allowed to be efficient at work? Is there a lot of redundancy in what I do? Do I have work-life balance? Do I have financial security? Is there opportunity for advancement? And we've talked about a lot of this, the prior speakers have. Do I get respect at work? And think about that. How many times do you actually feel respected at work? Do I get recognition for what I do? Do I get appreciated for what I do? Believe it or not, sometimes just a plain old thank you card goes a long way, and we never get it. We rarely get it. And am I allowed to be proficient? So these are how we tend to professionally define our professional happiness. So what you need to do individually is figure your career scale. Is your success and happiness level on the same level field, or are you off balance? So our typical surgery rat race, this is what it looks like. And most of us are trained to tolerate this. As you become more successful, you're expected to compromise on your happiness. But I think, and what I want you to think about and aspire to, is flip that linear pathway. You should expect and you should demand that as you become more successful, you're allowed more happiness. This is a novel subject, and it may be controversial, but I think we should all aspire to that. So how do you accomplish that? First, it starts by knowing yourself. You really need to be self-attuned. You need to know your strengths. You need to know your weaknesses. And you absolutely need to know your non-negotiables. That's what's going to break your back, and you need to know that. You need to recognize your external pressures. What's forcing you to be unhappy? What are you compromising on? And allow yourself to break free from that. And that's hard. That's not easy. Be realistic. So understand that when you break the norm, that comes at a cost. You're going to have to give up something, and sometimes it seems a big deal to give up what you're giving up, but at the other end, you're going to receive a lot more. Get rid of the guilt. There's a lot of guilt written in us, and we're bred that way. You're supposed to push. You're supposed to really drive your engine to the breaking point. And when you stop, you feel guilty about that. And you got to get rid of that and create a support system that sees your vision and understands your vision. I'm going to just give you a short case example, my personal journey. I started my career. I knew I couldn't do academics. Why? Because I can't tolerate politics. And I would not prosper in that kind of an environment, and that's all I saw going through my training, a lot of politically charged environments. So I decided to go in private practice. hoping for a supportive environment. I found myself in a practice that was great as far as volume. I loved my job. I absolutely loved waking up in the morning, going to work. I mean, loved what I did, but I hated my job. I hated how I did it, who I did it with, and how little control I had over it. So what did I do? I opened my own, first, I did a character assessment, and that's what I want you to, if you're leaving this room today, spend a minute or two doing that. What I'm good at. I'm a perfectionist, I'm dependable, I'm reliable, I'm non-confrontational, I love challenges, I'm a multitasker, but what do I hate? I hate conflict, I'm not good at it. I hate politics, I do not conform, anyone who knows me knows that. I hate stupidity, I hate redundancy. I don't do well in competition, I'm not a competitive person, and I'm horrible at time management. I do not do well with condescension and disrespect. You gotta know your non-negotiables, because that's how you're gonna decide what job you're gonna quit and what job you're gonna take. So I decided to open my own practice. What I love about it, I have complete autonomy. Everything's on my own terms. I tackle my challenges the way I want to. I solve my problems. It's completely patient care focused, the way I like to do it. I have complete work-life balance. I'm proficient, I'm efficient, and I'm innovative. Is it perfect? No, I gave up a lot. I gave up teaching, academic pursuits, income security, professional recognition, collegiality, and sometimes some of the harder cases don't come to me because I'm not in a big, fancy, ivory tower. But is it a panacea? No. Am I happy? Absolutely. I now only fight the fights I choose to fight, not ones that are forced on me. And there's nothing that I have to put up with that kills my joy. And so, as I said earlier, I hope that I can empower you to reevaluate your career trajectory just like I did, and hopefully find the courage to adjust that with your happiness. And just remember, course correction is not a weakness, it's a strength. Thank you.